If you have someone that you're concerned about and you're worried about them because of their behaviors or maybe some of the statements they've made or some of the actions that you've seen them involved in recently, that you're just concerned about them, that the ability to ask them and say to them, I'm worried about you. Are you thinking about ending your life? Just having that little conversation can be extremely important and showing that you care. So some simple points, just being there for that person who may be struggling and trying to keep them safe. If the response to your question or to that comment is affirmative, then you certainly don't want to simply say, okay, great, good luck, have a nice day. You want to have some further caring and compassionate kind of conversation with that person, as I said, to keep themselves safe, to try to help them stay connected with you or connect them to some mental health services, and certainly even some follow-up or checking in with them as you might encounter that person in the workplace or in your lives.
Hello to the veterinary profession. My name is Dr. Quincy Hawley, and I am the co-founder of Get MotiVETed Wellbeing Solutions. And I am here today with our behavioral health expert, Dr. Barry Feldman. As you may or may not know, September is National Suicide Prevention Month, and our profession, the veterinary profession, is one that has been noted as having an elevated suicide risk. And we want to have a brief discussion as to how you can support yourself and others as it relates to suicide prevention. I personally think that every month or every day should be Suicide Prevention Month and Suicide Prevention Day. So we as a company, Get MotiVETed, are committed to keeping this conversation going far beyond September and far beyond today. Suicide is often preventable, and in order for us to prevent suicide, action must be taken. And I can't stress that aspect of suicide prevention enough. And we must take action to obtain the basic knowledge and the competency as to how we can play a role in helping to prevent suicides, not only in the veterinary profession, but also in society as a whole. I personally, I've always had an affinity towards suicide prevention since I got into the well-being and mental health space. But personally, I've been affected by a few different suicides over the past year. And so I really have a burning desire just to help individuals who are suicide loss survivors to be able to have healthy ways of coping with that, as well as preventing suicide in our profession. And so with that being said, I'm going to pass it over to Dr. Barry Feldman, and he has a few words for you as well.
So as Dr. Hawley mentioned, September is National Suicide Prevention Month. September 10th, which was a few days ago, is World Suicide Prevention Day. And within September, there's also a National Suicide Prevention Week. So, the purpose of having these different commemorative dates and time periods is essentially to raise awareness about suicide. And first and foremost, I want to say that suicide can potentially be an emotional topic for many people, I'm sure for many of you who are watching this program, and we certainly acknowledge that. Hopefully nothing that we say will be upsetting to anyone, but should that be the case, you'll see on the screen that we have a phone number for the National Suicide Prevention Crisis Line. So That being said, as Dr. Hawley alluded to, we can all help prevent suicide, and that starts with being aware of the magnitude of the problem. Suicide is the 10th leading cause of death in our country. I know some of those statistics have recently been, unfortunately, subsumed by the pandemic that we're all sadly trying to deal with, and all the deaths incurred there. But again, let's focus on suicide prevention as our topic for this brief segment. Yes, suicide, veterinarians are at increased risk for suicide, but I think what's really important, and I want to emphasize that it has the fourth highest rate for suicide among professions, and that's certainly concerning. And the veterinary medical profession is doing some things, taking some steps, I think, to try to impact that unfortunate trend. So we can all help prevent suicide, as I said, starting with education and awareness. I think that there are a couple of points I want to stress here. One, I want to dispel the myth, and which is essentially an erroneous belief that we should not talk about suicide, or if there's someone that we're concerned about or worried about, we should not raise the topic of suicide. Research shows that people who are having thoughts of suicide can feel relief when someone asks them in a caring, compassionate way. Research findings suggest that acknowledging and talking about suicide can actually reduce rather than increase suicidal ideation. So, that's a very a key point here. And we are not planting any seeds. If you have someone that you're concerned about and you're worried about them because of their behaviors, or maybe some of the statements they've made, or some of the actions that you've seen them involved in recently, that you're just concerned about them, that the ability to ask them and say to them, I'm worried about you. Are you thinking about ending your life? Just having that little conversation can be extremely important, and showing that you care. So some simple points, just being there for that person who may be struggling, and trying to keep them safe. If the response to your question or to that comment is affirmative, then you certainly don't want to simply say, okay, great, good luck, have a nice day. You want to have some further caring and compassionate kind of conversation with that person, as I said, to keep them safe, to try to help them stay connected with you or connect them to some mental health services, and certainly even some follow-up or checking in with them as you might encounter that person in the workplace or in your lives. And I think another key point here relative to gaining more understanding about suicide is very simply to learn more about it. Educating ourselves will reduce the ignorance that unfortunately exists around this topic for many, many, many people.
Thank you for sharing that information, Dr. Feldman. And if you want more information, if you want to take action to increasing your knowledge of suicide prevention and learning more about some of the myths that are out there that could actually, I'm not going to say increase the risk of suicide, but that can just not serve us as a veterinary community very well, some of the myths and misconceptions. And if you would like to learn a bit out some of the risk factors that could increase the chance of suicide, and some of the warning signs to look out for in an individual you may be concerned about, or in some of your coworkers or family members or friends. Then we do have a course titled Veterinary Suicide Prevention Basics, What Veterinary Professionals Need to Know. And you can find that on our website. We'll have a link pop up somewhere on the screen. You can also check that out in the description below. There are also other programs that are out there that you get and look into. We don't care where you get the information from, as long as it's a reputable source. And we just want you to have that increased knowledge if that's what you want to have. So, and I'll have Dr. Feldman mention a couple of those resources for us briefly.
Sure. There are some really excellent national organizations devoted to suicide prevention. For example, the American Foundation for Suicide Prevention, AFSP.org. Another organization of that caliber is the American Association of Suicidology, suicidology.org. We'll put these websites up on, we'll have them up on the screen for you. And the National Alliance for Action for Suicide Prevention is another resource. So wonderful resources, lots of helpful material, and we hope you'll avail yourself of that additional information.
And again, we don't care where you go to get the information. We just want you to get the information. And so whether you use Get MotiVETed Suicide Prevention Basics course, what veterinary professionals need to know, or whether you use some other resource, it's not important. We just want you to get the information that you need to be able to help yourself and help others. Again, we would love for you to enroll in our course, which is Dr. Barry Feldman and I discussing many different things. It is race approved. It's one of the few race approved courses that are out there that are veterinary specific. And so I just encourage you to just go find that information so that you can provide support for a colleague, family member, or friend who may need your help at some point in time, or even for yourself in the future. That being said, again, we've got Dr. Barry Feldman, and his specialty is in suicide prevention, intervention, and postvention. And the veterinary community is just so lucky to have someone like that, or fortunate to have someone like that who could just share his knowledge of many years of studying the subject to help us out as a profession. So we're grateful for that.
Last point before we wrap up, please remember that suicide is often preventable.
Take home message. I like it.
Wonderful.
You guys take care.